All right.
Okay. Okay.
You can come and sit. Do your presentation from here.
Yes.
Come on this side.
Okay.
No, he's going to sit in
Yeah,
the chair.
right there. Yeah, you can sit there and do your presentation.
Oh, okay.
To you, he's not.
Okay. Assalamu alaikum, everybody.
Walaikum assalam wa rahmatullahi wa barakatuh.
My name is Laula Fear, and I have Giovanni with me.
Alhamdulillah.
When we translate my name, Peer mean an old guy. Giovanni mean a young guy.
Not that young, right? Look at the great.
Can we have him sit just next to him?
That's where you can remember me and him.
Oh, turn around?
Yeah, yeah.
Oh,
No, he
turn
wants you to come
yeah.
around over here and sit
Oh,
next to
sit
him.
over here?
Yeah, or where you are. You can put both wherever. Or on the other side. It doesn't matter. Forget the camera at this point.
Yeah.
You need to face the live audience.
All right.
So yeah. So come.
Face the audience.
Yeah.
Okay.
Yeah. Thank you.
Good morning, everybody. Good morning.
So we have a class today about first aid, CPR, and AED.
Okay.
That's our topic we have, and we're gonna try to learn like a teamwork.
Are you going to explain to us what?
Yes, I'm gonna explain that.
acronyms?
When we talk about a first aid, the first aid means just basic help. If anything happen, we do a basic thing. Somebody have a cut, bleeding, we put a pressure on it, and we call 911.
Okay.
And the second thing is CPR. Just I wanna share with me, what do you think these words stand for? What is the C? What the P? What the R? Anybody have an idea? That if I ask you any question you don't know, it's okay, no problem. If you ask me any question I don't know, it's okay. Nobody knows everything, but we can learn from each other.
R
So-
is resuscitation.
Yeah. How many of you have already
Previously?
a certification
No.
for first? Anybody? This is your first time?
This is
No,
my-
I have it. I
You
have
had
it
it
just
before?
inspired.
You had it. So only two, right? And him, I think, right? He also had.
Oh,
Yeah.
you have certification too?
Yes.
So the majority is brand new. Never.
No, just me and the sister.
Okay.
Okay.
Yes. Only two. All right.
Okay. So C is the stand for cardio.
Cardio.
Uh-huh.
Okay. So when I talk about cardio, what is cardio?
Your heart.
Heart. Okay. And the P,
Pulmonary.
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 When we say pulmonary, what mean that? What that word stand for, and what mean that?
I believe it means the circulatory system.
Concerned about breathing. You know, like
Breathing?
yeah,
The
Pulse.
tubes here.
yeah,
Breathing tubes.
yeah.
Pulmonary.
Yes. And all is a resuscitation.
Bring back.
Yeah. So sometime I translate English to in an easy word, cardiopulmonary resuscitation. I change to resuscitation to restart.
Restart.
So again I come back cardio. If heart is not working, how do you know heart is not working?
No beats.
No pulse. And pulmonary like a breathing. No breathing, no pulse. In other words, we can say there's no sign of life.
Uh-huh.
Then we give a CPR. That's very, very important. People are confused that, oh, somebody feeling not good, and we start giving CPR. In other words, we can say if there's no sign of life, then we give a CPR.
Uh-huh.
Yeah. And the AED That's the equipment we use to do CPR. Okay. Also, there are in a Red Cross we have a say three C. 3C. What is the 3C? That is a check, call, and care.
Check, call, and care.
Check, call, and care. So I enter in the room and I
Check to see what the situation is.
Yes.
Call the proper authorities.
Yeah. So
And then give care. And then you give care.
yeah. I enter in the room. I come in the mosque. I see somebody on the floor. So check the scene. You're gonna check the scene. If a scene is safe, if you see somebody on the floor and the wire touching the body, I'm not gonna touch. I'm just gonna call 911. But if a scene is safe, so I'm gonna approach that person. I'm gonna say, "You okay? You okay?" And the person will be sleeping. So I say, "Yeah, I'm okay. I'm gonna wake up." So, but if there's no response, so if I have somebody with me, I'm gonna say, "Please call 911." Check. I check. Scene is safe. I check the person is no response. I'm gonna tell somebody, "Please call 911." Now I'm gonna care for the person. Okay. So the person was not responding. So I'm gonna care the person. I'm gonna follow ABC. What is ABC?
The
Air,
alphabet. The alphabet.
air, breath, compressions.
Yes. So I just asking you when I ask you question, your mind started, searching
Oh,
that
sorry.
what
Oh,
mean
sorry.
that. So that's where you can remember.
Okay.
Okay. So I'm gonna follow ABC. The first thing, maybe the person is like this, blocking the airway. The first thing I'm gonna do, I'm gonna open the airway. And then I come down, I'm checking for breathing and I'm checking for circulation. Okay? So how we check for, I'm gonna come down and maybe I can hear, maybe I can see the belly go up and down, so that means the person no need a CPR. But if there's no pulse, how we check the pulse? Let's go and check the pulse here, everybody.
2 fingers
Yeah,
on the jugular vein.
yeah. So we have a 2RE here, and we can check. We can check here, but that's far from the heart. That's why they want us to check here. Okay, so I open the airway and I check for breathing and check for circulation. When I'm checking no more than 10 seconds. So I found there's no sign of life. So as a certified CPR, I'm gonna try to restart. So how we restart the heart? We give a chest compression. Anybody have a knowledge how many chest compression we give?
3, I believe.
30. 30.
30.
So, and anytime we give a chest compression, that should be a hard surface and a hard floor. Yes. So I'm gonna come closer to the person, and I'm gonna use my weight. If I'm far from here, that's gonna be hard for me. So I'm gonna come closer, and I'm gonna give a 30 chest compression. 30. When I'm giving chest compression, I'm trying to restart the heart. And then I'm going to pinch the nose. If I have a mouth barrier with me, I'm going to put there, I'm going to give 2 rescue breaths. And then 32, 32. After 5 times, I'm going to follow ABC. I'm going to follow, like I'm going to check maybe heart start working. Studies show that if somebody heart just stop, maybe we try to, we can restart. But if it takes a little longer time, even there's no guarantee we're going to start the heart. But we try to restart the heart. So after 32, I check, maybe heart start, so then I can stop. But if not, I'm going to continue. Also, I want to go more detail on that. The Red Cross, we have infant, we have a child, and we have adult. So, anybody have any idea that when we say infant, what age we consider that's infant?
For beginning of life to beginning of when they're born to 1 year old.
Yes, 1 year old. Very good. 1 year old. And we don't have a child, but what do you think about a child that what age we consider that that's the child? That's the Red Cross, they have own system that child. Anybody have an idea that what age we consider a child? From 1 to 8 years old or 55 pounds. If child is
From 1 to 8 years old or 55 pounds.
or 55 pounds.
Weight.
If child is more than 55 pounds, that means we consider adult. Okay.
And that's only for the purpose of CPR.
CPR.
Only for the purpose, when you're doing CPR, you're gonna consider a child to be between 1
So
and...
this is basically what I'm hypothetically thinking for the amount of pressure that's allowed to put on the chest.
That's
Yeah,
correct.
that-
And also the AED, the shock that we're gonna use. So if it's a 12 years old, we're gonna consider as an adult. So we're gonna use a different defibrillator.
Amount of voltage.
Yeah, the voltage. They have for pedestrian, for child, and for adults. It's different voltage. So just for the purpose of CPR is up to the age of 8.
Okay.
And then, so after that, the body is a little bigger.
A lot stronger.
So we're not treat them as an adult.
Yeah. Also, when we pressing the chest, for infant, child, and the adult is different. That's why I just separate that. You know. So 1 year old, the child from 1 to 8 years old, or 55 pounds. If more than 55 pounds, we consider that's adult. So when I'm giving a chest compression, so I follow CPR, so there's no sign of life for infant. And I'm gonna give a chest compression. I'm gonna use 2 or 3 fingers. 30.
30 and 2.
30 and 2. Different is when I'm giving a rescue breath, I'm gonna cover mouth and nose. That's different between a child and an adult. You know. So I'm gonna cover mouth and nose. Since Corona started, we not do practically just we explained that we give a rescue breath, we cover mouth and nose, and also when I'm pressing the chest, I'm pressing the chest 1 inch to 1.5 inch for infant. Anybody have idea inch? How much is the inch? Yeah, that's it. So I'm going to press the chest 1 inch to 1.5 inch. 30, and then 2 rescue. 32, 5 times. After 5 times, I'm going to follow ABC. I'm going to check maybe heart start working. We come in a child. I'm going to press the chest 1.5 inch to 2 inch. I can use one hand. I can use 2 hands for a child. I'm going to hold like here, and then I can use one hand to give a chest compression to child. And when I'm giving a chest compression to adult, so I can use 2 hands, and I use my weight. I use like this. 30 and 2. Also, the child, I pinch the nose and give rescue breath. And also for adult, I pinch the nose and give a 2 rescue breath. 32, 32, and then I check back again that if a heart start working is okay, but if not, I'm gonna continue. Also, I wanna give detail on choking, somebody choking. So,
Yeah. And before you go into choking, let's before you start anything, you have to identify the emergency.
Yeah.
Recognizing the emergency. You don't just gonna go, what is an emergency? So to recognize and identify the emergency, we use our senses. How many senses do we have?
Five.
5 senses. So we're gonna use those 5 senses to recognize emergencies. So one of those senses are sight, right? So we're gonna look around. So that's what Mr. Pierre, as you're coming into a room, you see a person laying down on the floor. What we're looking for? The unusual, not what is common, what is usual, or the unusual. If I see you sitting down there and you're sleeping, that might be usual. People get tired, they fall asleep sometimes, right?
yeah.
That's very common, very usual. But if I see you laying on the floor in a weird position, that's very unusual. So that's what we're gonna try to identify, anything that is unusual. Okay, unusual sight, unusual sound. So I'm gonna use also my ears to recognize anything that is unusual. Somebody that is bleeding, that's very unusual because people don't walk around bleeding, right? So anything that is unusual, that's what we're gonna look for. All right, somebody that is breathing rapidly, or maybe they look. Again, I'm using my sight. Somebody looks pale or looks confused, walking around, and their eyes are wandering. That's unusual. So it might be something up. Something is happening. So recognizing what is unusual. All right. So sight. Sound, I'm gonna use my hearing for sound. People don't walk around in the street screaming, that's unusual, right? Or banging, a big noise. Like a few moments early, we heard the kids running around. And that's very common, right? That's not unusual. There's kids, when you have kids, they're running around, they make noise. But if we only have adults in this building, then suddenly you hear a big banging upstairs, like boom. That's unusual. What happened? Maybe somebody fell. So anything that is unusual is gonna cause me to check. All right. So we want to recognize the emergency. Go over there and find out if everything is okay. So we saw somebody on the floor. Most likely they fell, right? Because that's unusual. All right. So what else we can use our senses? Sight, hearing. How can we use our sense of smell? How can we use that? Take a guess. Something that is unusual to recognize an emergency. Is your neighbor having a barbecue?
Yeah.
That's pretty common, right? That's good, right? But when the house is on fire, or if you have some burning wires around any room, that's very unusual sense of smell. So that can be a potential emergency right there, right? So just by the sense of smell, you walk into a room and you know when the gas is on, right? If somebody put the gas in and the flame is not on, you're gonna smell it right away. Right. Some chemicals are very powerful out there. You have chemicals that can kill you, forget about minutes, seconds. Some chemicals, you walk into a room, if you see somebody laying on the floor and you smell something weird, take off, run. Because could be some chemicals there, that's why the person is on the floor. Some chemical can kill you in seconds. All right, so what we do, if you see somebody laying on the floor and we smell something weird, we're gonna get out, leave that place and call the professional, 911. That's what we do. So we got unusual, right, things that we're looking for to recognize the emergency. So we use our sight, we use our sense of hearing, we use our sense of smell, right? We smell gas, fume, things like that. And what about touch? How can you use your touch to recognize an emergency? Very important. Anybody would like to? Yes. what something that is called? Yes, yeah, hyperthermia can kill, right? Or what about overheating? Right, somebody they have a heat, they can have a heat stroke if they are exposed to too much heat, right? So what about if I walk into my room and I have a baby and my baby's crying, right? So we wanna pick them up, trying to maybe hungry, right? Could be that the baby's hungry or might be wet. So why not? Okay, once you pick them up, as soon as you pick them up, you feel with your hands. This is very unusual. You feel hot, right? You know when a baby's having a fever because it's not normal. I mean, we all feel a little warm if you touch somebody, just very light warm, but not too warm because that's unusual. That means it could be a potential emergency. We need to respond immediately, all right? So that's for the touch. Walk into, okay, I want to walk into that room, right? I smell something. Where is coming from? Okay, let's believe that's a room. So I'm gonna go over here, and then I touch the handle and feel hot. What that is telling me, sense of touch. If that handle is very hot, most likely there's a fire in the other room. So I'm gonna leave the door closed because you don't want that smoke to come into this room or the flame, right? So we're using our senses. Okay, always that's what we use to recognize. One more sense that we can use, right? We have 5. We're missing one.
Taste.
Taste. How can you use your taste to recognize an emergency? That's weird, right? But yeah, you can. I see him having coffee, right? I got my coffee over there. So I can taste that coffee is pretty good. But if I start tasting a little sour, most likely that milk was bad, right? Have you gone into a place when you're eating and then the food tastes weird? And you have tasted the food before, but this particular day is different. Could be that the food is old, it's rotten. People get food poisoning. I have a friend who almost died. His liver got poisoned, something that he ate. He almost died. He actually needed a liver transplant. He was this close to death. The doctor was calling the family and telling, listen, start making arrangement for funeral because if we don't get a donor within 3 days, he's not gonna make it. So start making funeral arrangement. And within those 3 days, somebody had a serious accident, lost their life, a young man, and that was a donor right there. A match. And within those 2 days, that saved his life. But he almost died because of the food that he was eating. Right? So that's why we try to cook, right? With my friend always say, we always cook ourselves. You don't know what people have out there, right? Don't trust too many other places out there. But people usually get sick. But our taste is telling us when something is bad. Not all the time, but most of the time, right? Most of the time. So that's our sense of recognizing the emergency before you continue to proceed with those 3 C that my friend Pierre was talking. All right, recognizing the emergency, we use our 5 senses. Any question, any comments? All right, recognizing emergencies.
Yeah.
Good. All right, anything else?
Also, at home we are different, but if we have a certification and we are outside, somebody in trouble, we ask, may I can help you? Person say no, we just call 911.
That's it.
Yeah. If say yes, then we
Make
can,
an attempt to assist.
yes, we can help out.
That's getting consent.
Yeah.
Getting consent. So you're gonna ask for consent. You say, I'm Giovanni. You identify yourself. I'm Giovanni. I'm certified in first aid CPR. May I help you? And right away, somebody that need help, of course, is gonna most likely say yes, please.
How about the unresponsive individual?
Okay, unresponsive. There's somebody that don't respond. That's implied consent, because that person cannot tell me yes, please help me. So it's already implied. So according to the law, there's a Good Samaritan law. It's in all the states in the United States. You can go any place. It's applied. So that means I can help that person.
Can you
uncover.
explain what a good Samaritan is?
The Good Samaritan law is a
No, what a good Samaritan.
Oh, a good Samaritan, somebody that goes out of their way. You go that extra mile to help an individual. Not necessarily has to be your family. It could be anybody. Or you go out of your way. You want to help somebody. You want to assist somebody. You want to meet their needs. So good Samaritan is going to require a good heart. Somebody with a good heart. Because if you don't have a good heart, a lot of people just see somebody laying on the floor, cold. A good Samaritan would take their coat here, or you see somebody that is hungry. A good Samaritan would go and would, I'll be right back. Go to some place, get some lunch. Here you go. Enjoy your meal, right? Good Samaritan. So basically, that's what my interpretation of Good Samaritan.
No, it's
But you,
the reason why. See, we're Muslims, and as Muslims, one of the number one rules for us, our teacher of humanity, is to teach people how to be humane. The word Samaritan and the word humane,
they're connected.
that's absolutely positively together.
Yeah.
So when you want to do something for somebody, all right, when you're giving of yourself, when you're lending a hand, this is described in English as Good Samaritan.
Good Samaritan, yeah.
But as a Muslim, this is part of our total psychology.
Yeah. Started with the heart.
Right.
Have compassion.
There you go.
Not
That's the
pity, it's a different,
Right.
I
No,
always say the
compassion
pity
is
and
the word.
compassion is two different things, Pity, you can feel sorry for somebody, but you don't do nothing, you just feel sorry. But a compassionate individual is a good Samaritan.
Is a person
It will
that
go
gets
out of their
involved.
way, yeah.
Gets involved.
That's right, yeah, go out of their way, go that extra mile.
Right.
All right, so we cover for the Good Samaritan implied. So you're always gonna ask an adult. If the person is conscious, you ask the adult, may I help you? And the person's gonna say, if somebody's choking, they might not be able to talk, but they might nod their head. And this means yes, right? That's the universal language for yes, or this would be no, right? If somebody is choking, they tell you, may I help you? They say, leave me alone, right? That's what we're saying. Maybe they don't want to be helped. So in that case, and we see the emergency, we already recognize the emergency. We're using our side. And this is the universal language, right? So what we're gonna do is if nobody wants help, we're gonna call at least 911. Listen, I see an emergency here, individual having this emergency, send somebody. All right? So you're still helping by calling 911. All right? If they don't wanna be helped. What about if there's a child? Okay, you're gonna ask their parents or their taker. You're not gonna listen. I'm certifying CPR, may I help you, this and that. All right, but if there's no parents, there's no adults. Also, that goes into the implied consent, because there's no parents around. I can help a child, somebody that is minor, where there's no parents around, or somebody responsible for them. A child playing in the park, swinging and fell. If there's no parents around, then you can help out. You can still help, and that's implied consent. Yeah, and covered by the Good Samaritan law and all the states in the United States.
Also, the
Hold on, I'm sorry. Explain why that's important.
It's important because first of all, the training is necessary.
No. All that part is interpreted because you explained that. But why is it important that you get permission?
Right, because of lawsuit. Somebody like I was saying earlier, I can say some people actually carry do not resuscitate. They don't want to be resuscitated. If they're having a heart attack, they're having a necklace or maybe a chain, or they're having something in their wallet, a card that they don't want to be resuscitated. And if you do, you might get sued because of that.
Now, I'll explain the rest.
Mm-hmm.
Let's say it's somebody got diabetes, a terminal illness, something is really wrong with them, and they want to die. They have the right to allow their life to be terminated. There's a bunch of cases where a bunch of people have come up, and doctors have aided people to die, and they are being sued as a direct result of them intervening. If you don't get the consent of the individual, it's happened to me because my father, he didn't want to live.
Yeah.
He wanted to die. And they asked, can we terminate his life? Is it okay for us to turn off the machines? And there was a conflict of who was the guardian, since there wasn't my biological father and it was their biological kin. They allowed them to turn off the machines, overriding what I would like, which was to keep him alive. So in that instance, you have to understand that everybody, you assume that everybody might want to live, but everybody does not want to go through some types of terminal illness or what have you.
They have no resuscitate.
Yeah,
Do not
no wishes to
resuscitate.
stay.
Yeah.
Correct.
That's what we ask.
So you have to honor
You
their
have to
wishes.
get the consent. You ask, may I help you? And they're gonna say yes, or they're gonna say no. If they say no, you still see the emergency. What you do? Call. You're not involved. You just go walk to the side, get your phone. Listen, I see this. Somebody's bleeding, severe bleeding, and they need assistance right away. Please send somebody, and let them take it care. You know, and
Let them get involved.
yeah,
Let them
let them
talk
get. You know, but you call. Some people sometimes then maybe they might be confused.
Yeah, disoriented.
Disoriented. That's the proper word. All right. Yes.
One more thing I don't think I've heard either you mention. I think it's important that when you see an emergency, even though there might be nobody else and you're a good Samaritan, you want to help out, it's imperative that you point and identify somebody to call 911 as you come in.
So that's as we when we're ready to do that.
You're gonna get into that. Okay.
Yeah, we're gonna.
That's so important because that gets neglected. People
Yeah,
assume,
the calling. Yeah, it's
people
important.
assume somebody's gonna call and actually nobody calls. So sometimes it's been shown that a delay of when the calls come in. Because everybody's just thinking, oh, somebody must have called.
Yeah, so he was talking about the 3 C's, right? The first C stands for check. When I check what? The scene and the person. That's the first C.
Yeah.
Check the scene, and if the scene is safe, then I'm gonna check the person. Or I wanna check the person without checking the scene, I might drop dead too because of the fume in the room, right?
Right.
So check the scene, check the person. That's the first C. Second C, once that person is not responding, then I need to call. That's why it comes.
Yeah.
We have to call, and you know, with that, I had some experience before that I know. Actually, with my daughter. Now she's 37 years old. But when she was a baby, I think she was only a year old. You know, instead of calling, I decided to drive her to the hospital, which is not a good thing, because how long is it gonna take you to drive yourself or somebody, family member, to the hospital? We got red lights, we got stop signs, we got traffic, and if you blow the horn, people they think you mean rude. Yeah, you know, they're gonna think, yeah, I got the red light here. Nobody's gonna open up for you. They think you're trying to skip, right? But the ambulance is a fast-moving vehicle. Once they put the siren, everybody's gonna move out of the way. But not only that, they can go through red light, they can go through stop sign, they can go through against the one-way street. They can do whatever they want with those sirens going on. So they're gonna get to the hospital faster than me. My daughter, you know, almost had a brain damage because it took too long to bring her to the hospital. And I was trying to blow the horn, people waiting at the red light. Please let me out. They didn't know what I was. Did I have an emergency?
Right.
People don't know that. So don't expect for anybody to move out of your way. So the best thing to do is call 911 because they might be around the corner having coffee. So as soon as you activate that emergency number, the person that is close to you is gonna respond. Listen, we are around the corner. We'll be right there in 2 minutes. And boom, right there. And they're gonna bring everything necessary that we need. We don't have it. They have it. They have whatever they need. They have the skill. They have the equipment. So that truck,
Excuse me.
that ambulance.
Sorry.
Yes.
Say that again.
What part?
The first part.
Yeah.
See, what you just said a minute ago when you just advised us about you having the experience and you drove.
Mm-hmm.
See, skill. that skill is a necessary component, is what you're giving us right now.
Yeah. Mhm.
So without us having that experience, that
Right.
necessary component, then it's hard for us to recognize what we need, like you just said.
Yeah.
The 3 C's.
Now I
Check.
know, yeah.
You see? So from you to us, you're giving us scenarios that we can go by so that we can become more informed.
That's correct, yes. Yeah, without the skill and the understanding and the knowledge, we're gonna miss out. So I'm sure that some of us, we have experienced, I don't know if some of you have experienced any emergency. You know, family emergency happen every minute. Right now, while we're talking, so many emergencies all over. You know, they happen constantly. So the training is important because save life. CPR save life. It's proven scientifically if you're doing the right thing. So the technique is important. We're gonna go over the technique with more details, how to do it properly. The times allows, all right?
Okay.
Whatever
So-
we can, but yeah, doing things in the proper way, because you can have the knowledge, have it here in your head, but if you don't do it, if you don't practice and do it correctly, your knowledge is not going to help you. So you have to execute it. Yes.
Just a quick, very quick story. I know it's kind of short. Abdul Kareem, our brother Abdul Kareem here, Paul Jenkins, you guys know, Hakeem's father. He
Very, 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 very important.
very recently, last summer, he was leading a youth event. We invited all the youth in the Rockaway Islamic Center to the park. Here, he had a basketball tournament, a bunch of races. He was out there refereeing a basketball game, and just dropped.
Collapsed.
Literally, head first, collapsed, and he had a
Fortunately.
seizure, and that resulted in a heart attack on the spot. And if it wasn't for the nurse that was off call duty nurse,
She was
and a
there.
couple others came in right away doing CPR.
Right away.
The ambulance doctor told him he was done. Had they not been there for the CPR,
Yeah.
we would have had a funeral for him
Yeah.
the very next day.
Listen,
So
for
just
every
an
minute, I'm
FYI.
glad you say that, because for every minute that we delay CPR, we're losing 10% chance of survival for every minute. So
3 minutes, 30%.
30%
minutes?
off.
10
5
minutes?
minutes. You know what is 5 minutes?
5 minutes is half the
5 minutes
life.
means 50-50.
Yeah.
Have you heard the doctor say to somebody,
Got a
listen,
50-50
how they doing?
chance.
It's a 50-50 chance of the making or dying.
How long do
50-50.
ambulances take to get
So
to you?
if somebody's not getting help within 5 minutes, most likely they're having a 50-50 chance. If they survive, they might have some brain damage. So that's why every minute counts, for every minute. So right away we gotta do CPR, because like he was mentioning earlier, has to do with the heart. We wanna try to get the heartbeat back again, and we need to send what? Oxygen
Oxygen to the brain.
to not only the brain, every organ. We have vital organs. You got your liver, your kidney, you have your lungs, right? You have your brain, your heart. Every organ needs oxygen. Without oxygen, those organs, they're gonna start
Failing.
failing. Yeah. If we don't get oxygen within 5 minutes, your organ's gonna fail you. So, and how we provide oxygen?
To the heart. Blood.
Through the blood. By doing CPR, by compressing the heart, what we doing? We're squeezing the heart, and the heart is gonna send blood to every organ. That's why this is important, to do it right. For an infant, we have to compress how far? 1 to 1.5.
1.5.
If we only do it half an inch, guess what? I'm wasting my time. That baby's dying because only doing half an inch. I need to squeeze the heart, right? So I need to go further down, about 1 to 1.5 inch. All right, if you don't do it right, you might know all the numbers and all the technique, but if you don't do it right, we're just wasting our time. So what we doing with CPR, we sustaining life temporarily, because they're gonna need the ambulance and the hospital. And by the way, those ambulance, there are many, I would say, portable
Portable
hospitals. They have everything for the moment that they need. So right there, while they are being moved to the hospital, they're being transported, they are giving them all the medication they need, all the assistance they need, injection, and whatever they need. So that's why it's important to call 911. All right? 1.5. A child could be 2 to 2.5.
No.
I mean, so from 1.5
2.
to 2. An adult from at least, not less than 2. 2 or 2.5. All right? And it's important because the structure, your body, right? An adult, you got the ribs that is protecting your heart, so we need to press a little harder. For an adult, for a child, it's a little less. We can still use 2 hands, but PSA, you can use 1 hand. Depends on the size of the child. If it's a small child, you can use 1 hand. If the child's a little bigger, use 2 hands. For a baby, don't use hands, use fingers. This is one of the techniques we use. We use 2 or 3 fingers. Another technique they use, you can also kind of squeeze the chest with your thumbs there. See how I'm doing it?
2 fingers, yeah.
With your hands there, wrap them. Depends. If they're very small, an infant is only a few pounds. So you can squeeze and then, okay? If this is easy for you, you do it this way. This is another technique they're using. Or if not, you use your 2 fingers, which is more comfortable. All right, when it comes to CPR, always bring the person to the floor. Don't do it on the bed. I had a bad experience in the 80s. It actually happened in 1985 with my father-in-law. He was on the bed sleeping, he didn't wake up, and we was called, and I didn't have no training at that time, nothing. So I only heard about CPR. You heard, right? Of CPR, you press the chest. And I didn't know where to put the hand, so I just did this. And he was on the bed. You know, the bed, what happened with those springs?
Went down.
Went down. And I thought I was doing the right thing. And what I actually was doing was playing basketball with him. I was bouncing him back and forth. This is what I was doing with him from the bed. So it didn't help. I was not squeezing the heart. He was not breathing. Nothing happened. We tried to do rescue breath. We didn't know how to do it properly. You're supposed to do 2 chest compression, 2. You know, 2 rescue breaths are good. If this is somebody outside, a stranger, and you wanna offer your Good Samaritan skill, or you don't feel comfortable because you're not carrying a mask or something, you can still help out. You can still do chest compressions only without doing rescue breath. It's still good, chest compression. In the meantime, you know, the ambulance is on the way, and you're still compressing the chest, you're sending oxygen to the brain. So you're sustaining temporary. This is still good, but to rescue breath is better because you're directly sending oxygen to the lungs. So if this is my family and I don't have the mask, you're going mouth to mouth. My kids, my grandkids, spouse, brothers, sisters, uncles, and I'm gonna go mouth to mouth because it's better. All right? It's still good, only CPR. If it's any strangers out there with all these viruses going around, COVID and right, all these things. Sometimes people have a little reservation. I don't want to advise anybody to go mouth to mouth to any stranger. But if it's your family member, go for it because this is better when you're doing direct breathing. All right? Any question with that? A stranger, you can still just do a chest compression. All right? If you don't feel comfortable, you don't have a mask. All right? Sometimes they do have like a. Let me show you one here. Mr. Pia, you can go ahead.
I just want to add that good smart law protect me if I do according to my training. Second thing, I not accept anything. I said, oh, give me $10, I'm going to help you. The law no protect me. I do according to my training. I stay limit to the training, not anything extra. The law protect me best. And next we're going to go for choking.
Let me just show them that this is the breathing by very simple. Sometimes they come in a little package like this. You can order online, come with a gloves. It's good to use glove protection. And maybe Mr. Pierre, you would like to show them about the glove. But this is the max, very simple. Look at how it is. Make it easy for everybody because they have the picture of the face. You see the nose, you see the ears. So you're just gonna line up the nose and the mouth goes right there. That's the filter. So when you pinch the nose, right there, you'll be able to wrap your mouth and breathe through that filter. So you're not getting direct contact with the person. Some people, they're just carrying their packet and their bag, you know. But if you don't have one, I can still help that individual by just doing chest compression. All right?
Yeah, we use a glove also.
Yeah, gloves, especially when there's bleeding, any fluid, you can protect yourself from any contamination from fluids.
Next, we're gonna go for choking.
All right.
You know.
All right. Choking experiences. So let me see. Probably we can.
You have a video you're gonna show?
Yeah,
me?
we have some video, but maybe we can do it because of the time, right?
Okay.
Right, the time. So we're gonna keep some. Let me see something here. Trying to get on my menu here.
Okay. Again, we talk about choking. Somebody
Yeah.
choking. Giovanni, I can help you.
So-
say yes. So I approach the person and I hold under the arm like this, and I lower like this between the shoulder blade. 1, 2, 3, 4, 5, and then I'm looking for a belly button there. I put my fist like this. 1, 2, 3, 4, 5. So I continue till the object come out. For a child also, I'm gonna go a little lower, and I hold the child like this, and same thing between the shoulder blade. 1, 2, 3, 4, 5, and then I look for belly button. 1, 2, 3, 4, 5. Also, Giovanni, for infant, I hold infant like this. 1, 2, 3, 4, 5, and then here. 1, 2, 3, 4, 5. So if that thing come out, sometimes the black is not come out. So our heart need oxygen, and maybe I try to. But what happened? There's no sign of life. Then we do CPR. And that's called modified CPR. Somebody was choking, I try to help, and there's no sign of life. So same thing. I do a 30 chest compression, and anytime I do rescue breath, I check in the mouth because somebody was choking. So if something there, I'm gonna try to scoop out. Okay, Giovanni? Mm-hmm. That's the difference between somebody was choking and finally there's no sign of life. I do a modified CPR. That's different between a regular CPR and somebody was choking. I do CPR. Anytime I give rescue breath, I check in the mouth. If I see something, I scoop out.
All right. So what we're gonna do at this point, some of you would like to
You practice that.
practice a little bit. We're gonna use this dummy and
We have put on the floor.
do it on the floor and do it the proper way. All right, and I demonstrate, and then you will try. So right here will be okay. This.
Yes.
All right. So I'm gonna demonstrate how to do it. I'm gonna simulate, right? I'm walking into a room. I'm gonna use my 3 seats. All right. The first seat stands for what?
Check
Check. What? What am I gonna check?
the area.
The area, the scene, and then the person, right? That's the first scene. So walking in, and I see somebody on the floor. Could be here, this place, right? And then what I'm gonna do, I check the area. And also I'm using all my senses, right? All my senses, feel good, smell good. All right, seems to be safe. Then I'm walking in, I'm gonna check the individual. And you call them by name. You know, if you don't know their name, just say, sir, are you okay? Tap their shoulder. If they're not responding, so then if I'm with Mr. Pierre or with you, I'm gonna say, call 911.
Okay.
And when they call, you're gonna turn to also give the location, all the details, where you are. All right, so they're in charge to do it. So make sure you point one. Don't say somebody call 911. That's not good. Because then you're assuming, everybody's gonna assume that somebody went to call in. Point to somebody. You, right? Point to that person, or you call 911. Okay, and tell them we have an emergency. and that person is gonna give the location. All right, so while I'm gonna take care of that individual, we already know that EMS is on the way. All right, sir, are you okay? Call 911. All right, so I'm gonna start CPR. So the first thing you wanna do here is, Mr. Pierre talks about what?
ABC.
ABC. I'm gonna check for all those signs. All right, you wanna check to see the person is breathing. All right.
Yeah, you're gonna open the airway.
Wanna open the airway, look inside, okay? Put your ears close by, and while you put in your ears, also check, look towards the chest. All right, don't do this the opposite way. That's not good, because I need to see the chest. All right, this is not gonna help me too much. But this way, I'm using everything. I'm using my senses, right? My ear to see if the person is breathing. I'm using my sight to see if I see the chest rising up and down. You know when somebody's breathing, you can see, all right? And any movement, you're gonna feel movement with the feeling, everything, all right? You check for about 10 seconds, right? Okay, and then everything, nothing's happening, so I'm gonna start CPR. Well, we're gonna start with chest compression. I'm gonna get as close as possible, right here. We don't wanna do this because too far. You know, this is very difficult. You're gonna have to put a lot of strength. So bring it closer to you right there. We're gonna look for the center of the chest. I can see the nipple right here, right? So we're gonna look for the center of the chest. Just a little bit above, right there. The heel of your palm, right here, this part. Not the flat palm. This is not good. This is what I was doing with my father-in-law. Not good. You know, you wanna use the heel because this bone right here, gonna press. Right there, the heel, I'm gonna lace my finger, right? And the heel, not the whole thing like that, the heel. Right in the center, this part. Okay, everybody got that one? The heel in the center of the chest, and then I'm gonna lock up my elbow. Okay, don't do it like this. Lock it up, and then use your body weight. Bring your shoulder over. That's why you wanna get as close as possible. Because you wanna use your body weight. All right, so this, I'm using my arms only. Not good. I'm gonna need a lot of strength to do that. But if I go over here, see, I'm already on top. So with my weight, I'm gonna press down. So it's gonna be much easier. All right? So we're gonna do 30 chest compression. I'm gonna do just a few, okay? 2, 3, 4, 5, 6, 7, 8, 9, 10. You do it 20, 25, and 30. Once you finish, then you go over here. You're gonna tilt the head, pinch the nose, seal the mouth with your mouth. Just make a nice tight seal and give 2 rescue breaths. You breathe. Again, normal rescue breath should last about 1 second. You breathe. How long it take for you to breathe? About 1 second, right? Fill your lung and blow it in. Another one. All right, so we're gonna try that. Who would like to volunteer while I just show you? If we're here to correct, if you, because listen, the way I see it, this can be my children, or my spouse, or could be any family member. So it's important that if this emergency happens, which they happen every minute there's an emergency someplace. Emergencies do happen, not if, when they happen. All right, I experienced so many emergencies in my home, you know, and thank God, only the first one was with a negative outcome, sorry. My first one with my father-in-law because I had no training. That was in 1985, no training, he died in front of us. Now that I know, so I have other experiences. And of course with my daughters too, lack of training. Almost, actually it was pretty bad. Very bad because lack of training, I was not able to use all this instruction. And I tried to help to do something that I was not helping out really with those situations. So lack of training is not good. All right, so emergency do happens. It's not when. The thing is when they're going to happen. It's not if. It's when. Emergency do happens. All right, so when you have the proper training, help. So take it that way. Who would like to volunteer?
Maybe I do. Maybe
Go ahead, yeah, sure.
I'm coming close to the person. I'm going to use my weight, and I'm going to do a 30 chest compression.
Okay, how fast? That's a question. How fast you do it? How slow? So should be doing 1 minute. We're doing like about 100 revolution in 1 minute. So we're here 1 and 2 and 3 and 4. You don't want to go 1,
So 2%.
2,
2
yeah,
per second.
2% around there, right? It's about 100 revolution per minute, or 100. That's the speed you're gonna do it, right, per minute. So 2%, you're accurate there.
And
All
then
right.
I'm going to give 2 rescue breaths. 32, 32, 5 times. After 5 times, I'm going to check the sign of life. I'm going to follow A, B, C. So anybody want to come and give a 30 chest compression? We have a little practice that.
My young man, let's go. Aslam. In order, everybody, let's go. Yeah, Amir al-Masjid, mashallah.
This is very simple, believe it or not. It's a very simple technique.
He's camera shy.
Okay, don't worry about it. You're gonna be famous.
Remember, you want to clear the area, right? Clear,
Yeah.
point.
Come a little more closer if you want to. Okay.
Very good.
Very
Now do
good.
the tilt the head,
Us.
pinch the nose,
You're
2
enjoying it.
rescue breaths.
Yeah.
breath and breath. All right. We're just simulating the breath, the breathing. We're simulating. We're not actually doing that.
Very good.
But
Good job.
always the technique that we use it to tilt the head is we're using fingers. You can grab the chin. You can grab it like this to open it. All right. Put the forehead. Put your palms on top of the forehead and 2 fingers here to tilt. See the technique that I'm using? Right there is good. Or just grab the chin right there. Okay? That technique is important because if we're trying to breathe without tilting the head, the air is being blocked by the tongue. Okay? So the tongue relaxes and block the airway. So you need to tilt the head. All right, the same thing with us. When we fall asleep, what happens? We snore, right? You people are snoring because the tongue relaxes. The tongue is a muscle. Once you're out, the tongue goes down. You know, it's like every part of your muscle, right? You can be watching TV, you have the remote, as soon as you fall asleep, your hand goes down. Your muscle relaxes, your hand goes down. Your tongue is a muscle. Your muscle relaxes, goes down and blocks the airway. So when you're trying to breathe with the tongue blocking the airway, it's not gonna go through. That's why it's important to use this technique to tilt the head, right? Cannot breathe just like that. Need to tilt the head and pinch the nose. If you don't pinch the nose, the air is gonna, instead of going to the lungs, it's gonna go where? Back out again, through their nose. So pinch the nose, breathe through the mouth. All right, so anybody else would like to try?
Yeah.
All right, good.
Clear the area. Act like it. Make it real. Make it real. Make it
All right,
real.
you check the scene.
Check
The
the
scene
scene.
is safe. Now check the person.
Point at somebody.
Aslam, you okay?
He's a deep, he's a deep sleep. You have to tap him.
What are you doing? You waking up? You okay?
He's not
Everything
responding.
good?
There you go.
He's not
Oh
responding.
God. Oh, my brother.
Get help. Get help first.
That
Get
is my
help first.
prayer too.
Aslam, get help first. Call.
Okay, a little faster. 1, 2, and 3, and 4. A little faster than that.
There you go.
Yeah, that's it. Keep going.
Aslam.
Okay. Tilt. Pinch the nose. Don't forget to pinch the nose. Pinch it, pinch it. Breath and breath. Very good. Only 2 raise your breath. All right.
Faster. Yeah, there you go.
That's good. How many chest compression? 30. How many rescue breath?
Aslam, Aslam, come on.
And we're gonna keep going. we're gonna go, it's about 5 cycles. All right, 5 cycles. After 5 cycles, 32, 32, 32, 32, we're gonna check for signs of life again. If you see signs of life, then you're gonna put in the recovering position.
What?
If not, you will continue another 5 cycles until EMS arrive. By that time, you
Please,
should.
Islam, come back to me. Okay, very good, very good. So if we have a child, so we can use one hand, or we can use 2.
One fingers.
Yeah.
For the
So
child.
for the
Oh,
child,
not,
for the
not,
child.
not infant, child.
No, for the child. We can use one hand, we can use the 2 hands. But only I'm pressing the chest of 1.5 to 2 inch.
Yeah, depending how big is the child. Listen, every kids are different, right? We have look at those, you or compared to him, right? So we have a difference, right? So for him, right? Those 2. So we're gonna use maybe with him, I will use 2 hands. With him, I will use 1 hand, right? Because of the structure. It's a small ribs. So you use your common sense. It depends on the size of the. Could be a child that is only 8 years old with a 15 years old body. Some kids are big, right? So then, you're gonna put a little more strength, all right?
Can you explain me with the infant about chest compression?
Yeah, the chest compression for an infant. All right, so if this is an infant, under 1 year old, I'm gonna use, like I said earlier, 2 fingers, right? We can do it here. See, because they're so small, you can do it on a hard surface like the table. So you don't have to hurt your knees, right? You bring the baby to the table, right, and put it there, or on the floor. Depends. If you can bend down, or if you're having a hard time with your back or your knees, it's a baby. It's a small body. You bring it to the front. Bring it here. Again, we're gonna use 2 fingers. This is one technique. You're gonna press how far?
To 1 to 1.5 inches.
1 to 1.5
Very
inches.
good.
2 fingers right there. The head has to be in the neutral position. That's one thing about baby. Don't tilt the head, because when you tilt the head for a baby, you're gonna block the airway. So it has to be in the neutral position. Neutral doesn't mean that if the head is tilted forward like that, put it to the neutral. Right? This is neutral. Right there. Forward, back. We don't want to do that with the baby. Infants have to be in the neutral, straight. Let the head rest straight, right there, with your body. Neutral position, 2 or 3 fingers. The same thing. For everybody, it's 30 chest compression to rest your breath. Right? So that's what we do. And once we finish with that, the only difference with the breathing is we gotta cover nose and mouth. You're gonna wrap your mouth and breathe through both of them. Right? Make a tight seal so it doesn't escape through the side. Tight seal, and don't breathe as hard as an adult. That was one of the mistakes that my wife was doing. When my daughter was having that emergency, she was not breathing, and she was doing rescue breath. She did like about maybe 20 rescue breath. And she was breathing so hard that it's a miracle that my daughter is still alive, because she could have blown her lungs the way my wife was breathing on her. So hard and long. Only should be 1 second long. Okay, you breathe. That's it. That's it. Normal. Just you can see the expansion. But my wife was going so hard. It's a miracle that she's alive. So she was in the hospital for a while, recuperating. But we could have killed her because we didn't know what we was doing. All right, you just breathe normally. Again, an adult lungs compared to a baby lungs, they're so tiny, small. So you don't have to breathe that hard for them. All right, that's why we use also 2 fingers, a full 2 hands. All right. Okay. So who would like to try the baby? Infants. Now, you come. You can do what you prefer, to do on the table or on the floor. Let's do on the floor. Okay, the same technique. What about ladies? You okay? You feel okay? All right, ladies, okay? They're gonna try this. That's fine. Okay. You're welcome too. You're welcome. Go ahead. You wanna try? You Yes, come.
They're going to be hard for you. But it's
You
good.
try, no?
Yeah, go ahead, go ahead.
Come on.
Listen, if nobody's around and Junior is in the house, it's better than nothing, right?
That's right.
So let him try it, because until EMS, but as long as he knows that you need to call 911, right? In the meantime, nobody else is there, you do it. All right, try the best you can. You're gonna use all your body.
On
Right,
the baby.
closer. He's not responding. Not responding. So,
Call 911.
okay, he's on the way, all right? Okay, lock your elbow. Don't lift up your hands. Yeah. Okay, you wanna hit that little click. Okay.
You gotta come
Come
forward.
here.
Gotta go.
There you
Put your
go.
shoulder up there, right there. And push it with your body.
Okay, very good.
Okay, that's better than nothing, right? Okay, now how you do the tilting? You gotta tilt the head with 2 fingers here and here, like this. And then pinch the nose, right here. And then breath, right? All right, hello. Okay, very good.
Okay.
And
Very
then
good.
you're gonna do it back and forth, right? Once you finish through here, you're gonna go back to the center right here. Okay, this is where the nipples are, right? You're gonna put your heel right here. All right? You wanna hit that? See? When you hit that, you know that's about 2 to 2.5 inches. Right there.
Yeah, that's good. Very good. Very
All right,
good.
so if he can do it, everybody can do it.
And now we're gonna go for choking.
Choke, yeah.
When you was choking, and so you act like I'm
All
gonna
right,
help you.
I'm choking.
Yeah.
There's the body language, right?
Yeah. My name is Pierre, and I can help you. I'm certified CPR first aid. Okay. So I'm gonna approach him, and I'm gonna put my hand like this. I'm holding strongly, and between shoulder blade. 1, 2, 3, 4, 5, and then I'm looking for his belly button. Look at me, everybody.
Belly button.
Yeah.
Clasp the hands
Yeah.
together.
1, 2, 3, 4, 5.
Pull into the abdomen.
Yeah. So I'm gonna continue till that thing come out. So now we wanna everybody stand up and have a pair with each other.
Yeah, you're gonna feel it.
And show me how somebody was choking. How you gonna help?
All right, once you find it, make a fist, and your thumb is gonna be against the belly. Right about. See where your belly going? Your finger right about. Right there.
Them two over there. Them two
Go
over
in, go in
there.
the front. Come here.
That's fine, that's fine, that's fine, that's fine. Forget the camera. That's them. That's them helping.
Come on, you and him.
Oh my God! Oh!
Bend forward. Yeah. Simulate. Don't hit it. Simulate. That's touching.
That's them. You're killing him. Bend him forward. Bend him forward. Yeah. Now, go ahead. He's good.
We be holding strongly. You know, the person if you are holding strongly, they're gonna be fell down.
Okay.
It's that biryani. Bone got stuck last night.
All right. So the thing is finding the right place. All right. It's about what about the person is like very big and you cannot wrap your hands around the belly because they're too big. You can still use a technique they call it a chest thrust. You're gonna compress the chest because this is the lowest part. So you're gonna grab the chest.
I want to be a Muslim. I want to pray with y'all.
Okay.
Okay.
How are you, Mr.
I'm so hungry.
Come here.
Yes.
I'm gonna give you a donut right now. You want to? What do you know about Islam?
Okay. So everybody
What do
else,
you know about
do
this?
practice? Anybody else?
There you go. We don't have anything besides.
Well, you can come. Okay.
All right. So going to the technique, right?
Yeah. So
For an individual that is maybe too big that you cannot wrap your hands around, we're gonna do chest draw. Or a woman that is pregnant, they have the baby, we can squeeze the belly. So what we do with a pregnant woman, chest thrust. So we're not compress the chest. It's almost the same technique like CPR. See CPR, what we're doing? Basically what we're doing is chest thrust. See, we're compressing the chest, right? And you squeezing the heart, and that also can help the child, or the person. All right, so
You gotta get her a chair. Get that chair over here.
yes, do the chest thrust.
We try to our best. Are we learning from each other? Are we learning?
Yes, we're learning good.
So we gonna end up because I think we try to shortcut, we cover. Okay.
Let me one more
Yeah,
thing. One
yeah.
more thing when
Yeah.
the person is choking. When the person is choking, how long can you hold your breath before you pass out? How long? All right, estimate.
It depends on
Maybe
the
2
individual.
minutes, right?
Yeah.
You can hold your breath longer than that. Some people a minute and a half, after that they pass out. You cannot hold your breath for too long. If you go underwater without breathing, maybe in 2 minutes or minute and a half, some people are gonna pass out, right? So this what happens when we're doing CPR. If they are really choking, they're not breathing, it's just a matter of a minute or two, or maybe a little more for some. Or it's just a matter of a few minutes before they pass out. So we are gonna be ready and prepared to take it from there. Once they pass out, now we're gonna treat it as a CPR, but it's gonna be a little different than regular CPR. We call it modified CPR. All right. For example, if I'm doing chest compression to this person, right? And by the way, when you're doing chest compression, when you're doing choking, there's one other technique there also the same. Stay over here. If he's choking, right? Put your legs in between their legs, right there. Just in case, because how long can they hold their breath? About 2 minutes or more, right? 2.5 maybe. Then eventually, if this doesn't bring the object out, it's gonna pass out. So by putting my leg, they're gonna rest on my leg, then I'm gonna bring them back to the floor. All right, you understand what I'm saying? Mm-hmm. One leg there while the person is going down. I got my hands right here, right, bend down a little bit. And then we're gonna give back blows, 5, and abdominal thrust, right? So once they pass out, I'm gonna bring them to the floor, and I'm gonna start doing modified CPR, which is a little different, just a little bit. What's so different is that between chest compression, which are 30, and rescue breath, which are 2. Between that, I gotta do one thing that is very important.
Check the airway.
Check the airway for an object. All right, because the person was having a grape, might be stuck in their throat. By doing chest compression, I might eject the grape back out. Right, once you check, you look, open the mouth, you don't pinch, grab the chin, open their mouth. If you see an object, then you're gonna take it out. Because if you don't check and you do 2 rest your breath, what are you gonna do? Send it right back up. So that's why it's so important that you, in between chest and rest your breath, check for an object. If you don't see nothing, then do 2 rest your breath. And those rest your breath most likely is not gonna go in because the person is choking. The airway is being blocked. So don't expect to go really, but you're gonna do it anyway. Breathe, because by breathing you might push it in, back to the stomach. All right, but that's the technique you gotta use. Any questions concerning CPR or first aid or choking? Questions? We good? All right, so
Thank you very much. We take up
I don't want to take too much of your time.
Not touching their body. That's where we take up the collapse.
All right, yes, you have a question? Yeah.
Do you have to take the person, if they have a lot of layers of clothes on, do you have to take the layers of clothes off to CPR?
Take the cloth?
You said they have a lot of clothing on.
Yeah, though, yes, if you're doing CPR, you can do it right. You can do it right. A big coat, maybe yes, loosen up a little bit, but you can do on top of the cloth. When it comes to AED, that's the external defibrillator, that's the shock that we're gonna give. Then have to be a pair of chest. Then we're gonna have to take the clothes out. All right, and sometimes, might need to cut it. If you have a scissor, cut it. If it's stuck in there, we don't wanna waste time. Remember, every minute that we lose is 10% chance.
10%.
No oxygen is going to the brain. 1 minute went by, we already lost 10% chance. All right, so we don't want to, if something is stuck in there, get a scissor or something and cut it. And if we had the defibrillator, we didn't have a time to go over the defibrillator, but that's a automatic external defibrillator. Is a device that is going to give electrical shock to the heart. You know, maybe in another occasion we can go over that. All right. All right. Any question back there? Everybody's good. So far, good.
Thank you
Any
very
other
much.
question? That answer your questions? Yeah, right. That answer. All right.
Thank you very much, everybody, for your time.
good?
and,
All right.
We try to do our best.
All right.
Excellent job, guys. Got takbir.
Allahu Akbar. Allahu Akbar.
Okay, so we're gonna pass a sign-in sheet. Inshallah, we're gonna get the place registered. Faraz is gonna work on that, inshallah. And those that attended, you're gonna just figure out how to backstage, inshallah. So Faraz will pass. What do you need besides the name?
Email. The email now they're using CPR. There's some new things. They're using email.
Okay, name,
They can
email.
go on the website and download those certificates.
So name and email. So
Yeah.
name and email. So
For
Faraz,
this one, we're
pass
not registered to this class. So this class, you will not get a certificate because we didn't register.
Maybe they can do that date, maybe if we when there's this.
Like they, okay, you can try it. Yeah, you can try it.
You can do different days, no problem,
Okay.
because we cover.
Okay.
And when you.
All right. So Faraz, pass a name and email is what you need, and then they'll work on getting the certificates, inshallah, set up. Okay. Jazakallah khair, guys. Thank you so much, guys. We'll have some donuts, some coffee on your way out.
All
And
right.
Is still playing the video?
Sorry?
Is still playing the video? No.
No. Yeah, we good. We cover most of the thing without what that was on the video. Instead of watching the video, we did the demonstration. All right.
you get a pen. Faraz, you have a piece. Okay. Fantastic. Okay. Mashallah, you guys worked well as a team, too.
Yeah.
Good job.